Peptides are everywhere right now, especially in conversations around longevity, muscle, skin, gut health, and hormones. But if you've ever wondered what peptides are, how they actually work, and if they're appropriate for you, you're not alone. Today's episode is a clear, practical breakdown of peptides, what they are, how they function in the body, and how they can really support women's health, especially when they're used thoughtfully and appropriately. So let's start simple. Peptides are short chains of amino acids. Those are basically the building blocks of proteins. They are basically messengers in our body. So they signal things to happen in our body, normal functions, and they circulate to signal those things to happen. Some examples here are like some peptides are used to signal tissue repair, some support growth hormones, some influence inflammation, our immune system, and our gut. Peptides don't replace hormones, but they work similarly to hormones in how they signal things, and they can also have an impact on our hormone production. They also don't override our biology. They work with communication in our body, particularly when we're supplementing with them. These are natural things in our body that we may just be supplementing more with because some of these can be depleted as we age. Our production of peptides can go down, and that's why they can be a key factor to supplement with them when we're having issues with tissue injury, for example, or longevity concerns, more rapid aging. This is where they can come in therapeutically to use them to keep those signals going, even if our body is slowing down in its own production. Now, how is this especially relevant for women? Well, as women, our physiology is very dynamic. We have cycling hormones, we're more sensitive to stress, we have different immune changes when we're having big shifts like perimenopause, menopause, when we're postpartum and recovering there. We have really big peaks and valleys in what our body is doing. And over time, we can be especially sensitive to things like chronic stress, illness, hormonal transitions, and cellular signaling can become a lot less efficient. There's a lot more factors that can create a breakdown here. That's where peptides can be really supportive, and especially when the foundation is already being addressed. This is something that I want to make sure that you understand is that nothing out there still is going to replace the foundations of our health and well-being. That being having good sleep, having good recovery time, having good nutrition, movement in our body, good connections with other people, having joy and awe and wonder in our life. Those things are always going to be the most important thing, and nothing is going to bypass that. But again, peptides can be a supportive therapeutic tool to help our body do what it's meant to do and get back to having some vibrance. So again, peptides are not a shortcut. They really work best with your body, especially when you're doing other things to support your body. Now, some key ways that peptides can really support women's health and the areas that I've seen them truly shine. First is tissue repair and recovery. Muscles, connective tissue, joints. Again, women can be more sensitive to breakdown here, more in injuries, especially as we get into our late 30s and beyond. We can be more at risk of injuries with training, especially when we're going through hormonal changes, if we're postpartum, recovering from things like that. So this is where it can be really helpful to support tissue healing. And this can also help with aging, strength, and resilience too. So muscle repair is a key part of getting stronger because we have to injure our muscles on a micro level to then repair them and have the muscles become stronger. And if we're having a hard time with repair, then this could be an issue. Our skin needs to be able to be repaired. We need to have good collagen production, gut health and immune support. Some peptides are incredible at supporting our gut integrity. The lining of our gut can be very vulnerable to the things we're exposed to, the things on our food. There's so many inflammatory things in our diet and our environment nowadays. And so we're very prone to getting leaky gut or breakdown in the lining of our gut. So having peptides that go in and create healing here can also be incredible and create so much change with our gut health if we're having issues there, as well as our immune health, because our gut lining is really a key factor in our immune health as well. There are other ones that particularly support immune signaling in a very targeted way. They modulate immune signaling, can be a key factor when we have autoimmunity, when we're having immune system issues. And this can also impact then our mood, our hormones, inflammation because these things are so tied together. Another key area is our metabolic and body composition. So some peptides, like the GLP-1 medications that you've heard about, you've seen, you've talked to people about, they're so popular right now. Those are peptides that influence our hormone signaling and our digestion and our hunger cues. So that can have a really big impact on our weight as well as our lean mass recovery, metabolic health. There are other ones too, not just the GLP-1s that can impact our weight in different ways and really have positive benefits when we're struggling a little bit more, when we're in perimenopause, for example, and our weight is changing, and this can have a really big impact. And lastly, our skin, hair, and tissue health. So some peptides are really amazing. Collagen signaling, really supporting glowing, healthy skin and hair. Some are used topically, like some of the copper peptides. Now let's get clear on peptides and hormones. This is a common misconception that I hear that they are somehow tied to hormone replacement. They're not. They can feel like you're replacing something, putting something into your body that way, but peptides are not going to be actual hormone replacement. They can support your systems that influence hormone balance, that influence hormone production, but they're not actually replacing any hormones. They're really more just supportive. So think of it in terms of supporting responsiveness, supporting our cells being able to function more optimally rather than actually replacing something hormone-wise. Now, who should consider peptides? Who are these really good for? Who are maybe they not so good for? They can be amazing for someone who's already addressing their health. They're already addressing the foundations, doing work to take good care of themselves. Those who are navigating perimenopause, these can be amazing, or a recovery phase. Someone who's plateaued despite everything else they're doing. This is something I see it as creating a new normal for people. I definitely recommend working with a qualified practitioner as well when you're using peptides. I wouldn't do this all on your own because you want to make sure that you're working with someone who understands how they're working, what the goals are, and can help you navigate through them and how to dose them, how to continue them, when to stop them, all of that. And they are not appropriate, again, as a first step, as something, you're not doing anything else. If you're trying to do this as a replacement for good sleep, good food, stress management, or something that's just done kind of willy-nilly, I wouldn't just throw this in without being mindful about it and, again, having some strategy behind them. One of the most profound areas that I see a big change is in immune function, reactivity, histamine response, and gut health. Things like BPC157 as well as TA1 can be really powerful in supporting our immune system and healing our gut lining. Another really great one and another popular one that there's a lot of conversation about is NAD. So NAD, if you've never heard of it, basically a precursor to our energy production. And so our cells use that to create energy. And again, if we're having a slowed down response because of aging, because of whatever else getting in the way, then supplementing can be helpful. Now, one of the barriers with supplementing NAD is that you can't really supplement NAD itself orally. So there are a lot of precursors that can be really helpful and beneficial, but you can also use it in injection form, NAD, to give your cellular energy back so that you can then thrive. Your cells are able to do what they need to do. Recovery can come back on track, all of that. If you're curious about peptides or wondering whether they're appropriate for your health, the first step isn't just going out and ordering something. It's talking with a trained practitioner to make sure that they're right for you. Talk about your overall health goals and then making a strategic plan.